Okay, next up we have the Dean of the School of Public Health, Dean Shawn Gerstenberger. Dean Gerstenberger, would you like to introduce yourself and tell us a little bit about you?
Oh, of course. My name is Shawn Gerstenberger, and I am the Dean of the UNLV School of Public Health. And we have had the privilege of working with NOMHE for their entire 20 years, and very closely through a partnership that we have where we run the Nevada Minority Health and Equity Coalition, which really acts as a partner to NOMHE to make sure that we can collectively move the needle and impact some of these populations that suffer disproportionate burdens of diseases and equity. And we are excited to continue that partnership and to work with them to solve some of the problems that we know we have in Nevada.
Thank you, Dean.
Yeah. Short and sweet.
Yeah, I think that was awesome. All right, so the first question is, how did you first connect with NOMI? And if you can't remember your first meeting with NOMI, alternate question is, what is your earliest memory of NOMI?
Well, I have been with the School of Public Health for, since its inception. And I think a lot of what we do overlaps. So, 20 years ago, we were working on issues that are related to health and health equity, and it is a core component of the mission and vision of not only NOMI, but of the School of Public Health to really align and work with health equity. And so, we've had the privilege of working with them for, pretty much the whole 20 years and looking at and addressing health disparities and inequities and using the data to drive evidence-based decisions in the state. So I've really been involved with them from day one, right out of the gate.
Wow. That is really good to hear. Perfect. And then we'll kind of edit these videos and kind of combine them. So
Sure.
all of the questions in between we'll take out. The second question is, what has been NOMI's greatest impact on your organization or the community that you live in? So it's a two-parter question, and or the community that you live in.
Yeah. So I think the greatest impact that they have had with the UNLV School of Public Health is that the Nevada Office of Minority Health and Equity and the Nevada Minority Health and Equity Coalition that is run by the school were really created together to make sure that the needs of the state are evidence-based and that we are including our community partners as equals, as part of everything that we do. The old saying, nothing about us without us, I think is kind of the mantra of both of these organizations. And they were designed together to be a check and balance system so that as you work for the state and you promote health and health equity and you use data and evidence to prioritize these areas, that the communities are an integral part of all of those things. And that's what the coalition does, and that's what NOMI does. And that's been a beautiful relationship where we work collectively to have this impact in our community, to make sure we're working in the right areas, the right populations, with the right communities, but them as equals using this community-based participatory research model. And to me, that has really transformed our school, I think, in a positive way. And accordingly, through the hundreds of community partners that we work with, has trickled into all areas of the community, all races, ethnicities, genders, all sorts of different things, diseases and topics. We've worked together to try to improve health in all these sometimes hard to reach communities. So I kind of doubled down on you and answered them both at once there. But
That was a wonderful answer. I was gonna say, you're spot on with the collaboration with NMAC as well. So
yeah,
thank you for that. Thank you for that. And then the third one is an interesting question as well. What do you see as NOMI's potential for future impact?
well, we certainly have not solved all the problems, right? There are still things that remain. There are still issues that occur. And I think NOMI really can act as that guiding light to say, here are the issues that still remain in our community. How do we identify those? How do we prioritize those? How do we make sure that the state the universities, our nonprofits, our community partners are working together to maximize our impact. And I think that's been NOMHE's role for a very long time, is to pull all these complicated pieces together, align resources, and then move the needle to improve health outcomes. So going forward, we have work to do. We still have disparities. We still have disproportionate burden of diseases in populations. And I do think that we can certainly prevent, reduce, and hopefully in some cases eliminate those disparities if we work together, and NOMHE kind of acts as our North Star to guide how we get there.
That is really, really good to hear. Thank you for those wonderful answers, Dean.
Yeah, we work
thinking
closely. It makes it
thinking
easy.
back to any of those three questions, did you want to add anything to either of those questions? Or, I mean, I don't think you need to, but is there anything else that comes to mind?
Well, I think our partnership with NOMHE is such a strong one that we wanted them to co-locate with us, and we were excited that more recently that could happen, and that NOMHE actually is co-located now within the School of Public Health, and we work very closely between the coalition and NOMHE, and we make sure that we are each other's check and balance. You know, what we're doing is the right thing through all lenses and from all perspectives. And I think that's why it works. So it's a very close relationship. And so it became so close that we said, well, we might as well cohabitate and move into the same facility and really foster the relationship that we value. So we're thrilled that you're here and that now you at least have offices and spaces right next door to us in our same building. So
Yes, that worked out really great. So thank you for your help pioneering all of that.